I'd like to recognize Mr. Stearns, who also sits on the Veterans Affairs Committee. Really appreciate your efforts in helping us deal with veterans issues. And Mr. Stearns has two bills before us today, H.R. 516 and H.R. 5996. So, Mr. Stearns.
Good morning, and thank you, Mr. Chairman, and thank you, Ranking Member, Mr. Brown, South Carolina. As you mentioned, I have two bills before the committee today. H.R. 5516, Access to Appropriate Immunization for Veterans, and H.R. 5996, a bill to help veterans with chronic obstructive pulmonary disease, COPD. The first bill is a bipartisan bill that I'm proud to have introduced as a co-founder of the COPD caucus. It's the fourth leading cause, COPD is, of death in the United States. It is predicted to be the third leading cause of death by the year 2020, beating both diabetes and stroke. And 126 Americans die each year from this disease. That's about one death every 4 minutes. My bill, Mr. Chairman, would increase the VA's ability to diagnose, treat, and manage COPD. COPD is a chronic condition that does not have a cure. Early detection and treatment is important to slow or arrest the progression of the disease. It is estimated that more than 12 million people are diagnosed with COPD, and yet this number is believed to be small, as COPD is often underdiagnosed. The Center for Disease Control and Prevention, CDC, estimates that over 24 million Americans have symptoms of COPD. Despite all this, there is a lack of awareness by patients and doctors about this disease. It's a progressive disease. Early detection is extremely important, and because there is no cure, early treatment is vital. Because COPD rate is 3 times higher in the veterans population, Mr. Chairman, than the civilian population, how can the VA not be providing this type of specialized care? COPD is the fourth most common diagnosed among hospitalized veterans ages 65 to 74. H.R. 5996 would have the VA develop treatment protocols and related tools for the diagnosis, treatment, and management of chronic obstructive pulmonary disease. It would also have the VA establish a pilot smoking cessation program targeted towards individuals who have COPD. While there are many ways that someone can develop this type of disease, the most common is from smoking. However, it should be noted that COPD has underlying genetic risk factors, and healthy non-smokers can also develop COPD. I think it's important to note that this is not giving VA any new authority. VA already has the authority to do what I'm asking for, but for whatever reason, they have not aggressively moved to develop these treatment protocols for the fourth leading cause of death in the United States. My bill would have the VA begin to develop these treatments for our veterans. And this bill has the support of the U.S. COPD Coalition, the COPD Foundation, the American Thoracic Society, the American Association for Respiratory Care, and the Alpha One Foundation and the Alpha One Association. And I'd like to submit, Mr. Chairman, by unanimous consent, the letters of support for the record.
Is there any objection? Hearing none, so ordered.
My bill is the other bill is Access to Appropriate Immunization for Veterans, H.R. 5516. The VA already has the authority to provide vaccines to veterans to immunize them against preventable diseases. However, the VA has only established performance measures for 2 vaccines. For these two against the flu, and for these 2 vaccines against the flu and pneumonia, the vaccination rate increased from 27% to almost 80%, and hospitalization rates dropped in half. My bill would extend all the Centers for Disease Control and Prevention recommended vaccines to the performance measures. It is important to note that the vaccines are not just for children. In fact, just last week, the New York Times ran an article on how important it is for adults to receive vaccines and booster shots. I'd like to read a part of this article quickly. Adult immunizations are not just an important way to prevent the spread of the disease. Immunizations are also a phenomenally cost-effective way to preserve health. When you compare the cost of getting sick with these diseases to the cost of a simple vaccine, it is a modest investment, said Dr. Robert Hopkins, a professor of internal medicine and pediatrics at the University of Arkansas for Medical Services, end quote. According to the CDC, Each year, approximately 70,000 adult Americans die from vaccine-preventable diseases. Influenza alone is responsible for over 1 million ambulatory care visits, 200,000 hospitalizations, and 30,000 deaths. Only 7% of Americans over the age of 60 have received the vaccine to protect them from shingles, a painful nerve infection. Just 11% of young women have received the vaccine against HPV that causes 70% of all cervical cancers. Many of our veterans who are in the high-risk category of contracting vaccine-preventable diseases include those with HIV, hepatitis C, and substance abuse disorder, are enrolled in the VA healthcare system and could simply benefit from receiving these vaccines. I want the VA to provide superior quality care to our veterans. Adding vaccinations to the performance measure is a simple, common-sense idea that will increase the level of care available and save money by stopping preventable diseases. The bill would also require the VA to report back to Congress on their progress of supporting vaccinations within the veterans' populations. And I'd like, in conclusion, to enter the New York Times article into the record and the CDC's recommended vaccination schedule for adults by unanimous consent.
Is there any objection? Hearing none, so ordered.
And thank you, Mr. Chairman, for allowing me to testify.
Thank you very much, Mr. Stearns.